Hi, my name is Shiv Nadkarni. I'm an artist and medical school applications coach and tutor and kind of counselor based in Los Angeles. I'm a graduate of the David Geffen School of Medicine at UCLA. Before that, I did my bachelor's degree at the University of Pennsylvania in neuroscience and theater. So I've always done kind of the performing arts, dance and acting alongside my medical training and science. And I really think that both of them inform each other. So before I went to medical school, I did my master's in dance through the Fulbright program at a school in London. And there I was studying for a specific kind of reading of the Indian classical dance form that I do. But while I was there, I was also studying with the dance psychotherapy department. I did some work with dance and Parkinson's. I did some work with kids with autism and dance. And so I've worked in the dance therapy space as well, which has really informed my career in medicine. What I'm doing now is I'm foregoing residency for now. If I did it eventually, it would be in psychiatry because I've done a lot of mental health care work and mental health work with adolescents in LA. That's what my research has primarily been around. But right now I'm working on building my own business in kind of nutrition, lifestyle, and bodily approaches to mental health care that follow kind of more of an integrated medicine model. And I'm also focusing on some of my work as a performing artist. So focusing on some short films and things that I've written and having those produced and made. So while I was in school, I was very involved with the global health program. I was part of our global health pathway that ended in a global health scholarship my fourth year where I went to India and worked in a hospital there. And my family's from Mumbai, so I worked in a government hospital there. I can speak Marathi and a little bit of Hindi. So that was a really elucidating experience. I learned a lot there contextually, and that I'll be bringing into my clinical work and just my general life work here. I was also involved in the structural racism and health equity thread, and so I was one of the tutors for that. I was paid to create programming, create lectures, and so I would teach some of the lectures. I specifically taught the lecture on queer health justice. I was also the liaison to the Hammer Museum, which is a museum that has a partnership with UCLA. And so what I did was I created this night where they would open up their galleries and their space to UCLA Health, and I led a breathwork and meditation workshop during that evening. So we kind of focus on somatic approaches to healing as well. In terms of admissions, I worked with the Dean's Office, and I was on the Dean's Office application review committee. So I reviewed some applications for that. I also would help with recruiting for our global health program and review applications for that. So I know what folks are looking for in terms of applicants to programs within medical school and to medical school. Key successes for medical school, I would say, are being self-sufficient, finding your own kind of thread of independence and how you work best. Because I think it's kind of like you're running on a treadmill when you start and you're just getting an onslaught of information. So it's important to practice discernment. So it's not about learning everything perfectly the first time and stressing out over it. I think that's where a lot of folks get overwhelmed. But it's realizing, okay, how can I create a study schedule that works for me? You have to figure out how medicine and medical school exists within the totality of the rest of your life. And I can kind of help you do that. I think what's unique about my approach to medical school consulting is I focus on the person first. And so I really think that the applications in general are a narrative-driven process. And so it's important to first do that inner work to figure out really why am I applying to this? What do I care about? Who am I? These are big questions, right? So we have to distill them down to figure out how we can first tell the truth with authenticity, because I think authenticity is the thing that speaks loudest and speaks the greatest to an application, reader, whether that's in person or whether that's through an essay. And so how do we first find that story to then convey that through words and convey that through you? I've done coaching through mentorship. I've done kind of a lot of psychoeducation support with adolescents and mental health through my research. So I know how to elicit story from people and really make you kind of go there in your own life and figure out what are those things that I'm gonna wanna put into this application. And so it's gonna be a lot of introspection. I really like to find unique traits and what makes you unique, and what makes you unique is your authenticity. And so bringing that out is going to be really important in the process. They're interviewing you and assessing you, obviously, but you're also assessing them and seeing if, is this a good fit for me? Because you want to go somewhere, you're committing 4 years to that, 4 or more years, and you want to go somewhere where you feel supported, somewhere that aligns with your passions, your values, the things that you care about. And you want to make sure that you're making that choice intentionally and with a lot of thought. So that's why it's a two-way street. And I kind of think through the approach and the application process in that way. I'm passionate about helping students apply to medical school because I think narrative and story is really important. And I think that's the first thing that gets missed when you're applying. The first things that you think about is, what are my accomplishments? What are all my leadership roles? What are my scores on my exams? But at the end of the day, this is a career that values and rewards your humanity. And I think that is the thing that comes across most in an application. And so I think crafting that is really important, and crafting that authenticity and make sure that gets seen. So that's what I'm really passionate about, helping students build and finding that within themselves so that it's exuded and then, reflected in the application.